Good afternoon, or good morning, everyone. Happy Friday. Thank you for joining us today for our question and answer session on the new ELD August 14th guidance. My name is Tammy Scott. I am the Field Operations Director, and I'm going to pass it over to my colleagues so that they can introduce themselves also. And Aaron, why don't we start with you?
Hi, my name is Aaron Rain. I'm the administrative support for Community Systems team with the Early Learning Division, and I am here kind of in an IT support capacity. Welcome.
Great, thank you. Catherine?
I'm Catherine Miller, and I am one of the regional managers out of our Portland office.
And Ellie.
Good morning, I'm Ellie Katara, and I am the regional manager for the Salem area.
So I can tell you that I know you have a lot of questions, and we're going to spend about 45 to 50 minutes of our time today directly answering your questions. I'm going to start out by going through some questions that I already know that I've been receiving a lot, so maybe we can just bang those out early, and then the additional questions that you have, we're going to spend most of our time talking about them today. I'm quite confident that there are going to be some things that you're going to ask that I'm not necessarily going to have an answer to right away, and I can tell you that Catherine's writing down all those questions and we're taking those forward to address them. And also Ellie's going to be monitoring the Q&A, so if you have questions you want to enter in the Q&A, and then Ellie's going to be keeping that flowing so that we can get through as many as we possibly can. So first I want to start out by sharing with you all some resources that we have on our website. The first thing that I think you're going to find to be really very helpful is that we're posting videos that are going to cover each of the 14 sections of the ELD guidance that was issued on August 14th. And to help you find those videos, you'll go onto our website into the COVID-19 resource section. You're going to follow the green arrow and click on the location for providers. And then you're going to go scroll down the screen a little bit and then click on this part that says Health and Safety Guidelines Video Series. We're posting videos in English and in Spanish. And I haven't checked today to see how many are posted, but the last time I checked, we had about 8 or 10 of the topics posted. So we are still working on producing a few of them, but as we get them produced, we're getting them posted. And I can tell you, I spent a few minutes the other day watching the videos. They're all very short, about 4 to 6 minutes, and I found them very helpful. I know reading is one way that we can, cement the information in our head, but then also when you could sit there and just listen to it, I think it does help also to support that learning and understanding. It's also a great resource for you to use with your staff when you're training them on these points, and you could even point your families to them to help them understand the guidelines that you are under during these times. I also received an email from a program thanking us for the videos, saying how helpful they were. So I hope that you'll take some time and check out that resource, because it really is a great opportunity for you to have another learning opportunity for these guidelines. Okay, a few more resources that I also want to let you know are coming or already in process. You all have posted a lot of really great questions to us, and I can tell you from the last session that we did that was not a Q&A where we were introducing the guidelines, we got the chat log from that, and I've gone through every single one of those questions, pulled out the things that I don't think are clearly answered in the guidelines or that I'm seeing frequently, and working on developing an FAQ that is going to be posted on our website. I do hope that that gets posted sometime next week, so keep checking our website, because that's going to be a really great resource, and the questions are directly from ones that you all have submitted to us. We're also going to be hosting additional calls in the following weeks. Next week, the format is going to be a small group discussion. So then we're going to break down into small groups and actually be able to have two-way conversations. So I think that's going to be really beneficial also. And then we're also working on a whole library of support documents that are going to help you with implementation. There's going to be documents such as a checklist for you to use when you have if you have a confirmed COVID case, on who all you need to contact and what steps you need to go through, a health check form, information on PPE requirements, and kind of breaking it down into some easier to understand terms and with diagrams and illustrations to support you. a transportation template. If you're a facility that does transportation, we're working on a template that you can use for your transportation plan, and also updating documents such as the exclusion document. So keep checking our website. Once we have those ready and translated, we will get them posted to support you. So we're going to start out now and do about 5 minutes with some questions that we've already been receiving. And then after that, we're going to open it up to you. So we're going to start with just a very general question, some general questions that we've been getting. And first one is, if a county is moving back in phases, so going from phase 1 to baseline, what will the grace period be to reduce slots? So the exciting thing is that as of today, August 28th, no county is in the baseline phase. So that's really great. And we're hoping that that remains and that we're all as a state able to control the spread of the virus. But if there is some backsliding and counties do have to go back into the baseline phase, which would then affect the number of children that you're allowed to have in a stable group, we will be working on a grace period. We recognize that that's going to be needed, that you can't just one day say, oh, I'm cutting my group in half. So the ELD is working with the Oregon Health Authority to determine this, but we are aware that there needs to be some process for that, both for you and for the parents. So big question that's been coming up with the fact that schools are in distance learning mode. What is the responsibility of the provider to ensure school agers are attending school? And the honest truth is that there are no regulatory requirements that put the onus on you to ensure that children are completing their distance learning. You aren't required to provide computers or internet access, and this should be really something that you're discussing with your families and have an agreed upon plan with them, but from our end, there is no regulatory responsibility. Okay, drop off and pick up. There's been some questions about the requirements to have drop off and pick up occurring outside the facility. So what if a parent is coming late or in the middle of the day? What we would suggest is that you have something set up ahead of time with your parents so that they have a phone number that they'll call and somebody can meet them at the door rather than having them enter into the program. And the purpose of that is really, again, everything is about preventing the spread of disease. The fewer people that you have entering the program, the fewer people that you have exposure to for the children, the fewer people who are breathing the air and going up and out of the ventilation system. So that's the reason for that requirement. So set up something ahead of time with your families. We've gotten a lot of questions about outdoor drop off and pickup. That might not be possible or that might be concerning because of hazards, busy streets. I'm also hearing questions about what are we going to do in the dead of winter if we have a foot of snow. So the guidelines around outdoor drop off and pickup are really in place to minimize the spread of the disease and to prevent it from ending in the ventilation system. So if you have a situation that is really extraordinary, that it's just the location of your facility creates a big hardship or a danger for children, please consult with your licensing specialist and we'll try to problem solve with you through that. Okay, so some questions about health check. There's been some concerns about the temperature taking. So now if you've read in the guidance, temperature taking is again a requirement. And there's been questions about if the parent prefers an alternate temperature taking device. Maybe they don't like the one that the facility uses. Can they take the temperature when they arrive? And the answer is yes, they absolutely can. They just need to do it in front of your staff person who's responsible for the temperature taking so that the staff person can verify the temperature before the child enters into care. The goal, the rule is of this guideline is that an accurate temperature is taken. We don't care who's holding the thermometer, but that the staff is able to verify it. Okay, group size. Once the children return to school, so when distance learning is not required and maybe there's some hybrid learning options happen, what's going to happen? Will children be able to be in a stable group at school and then a different stable group in childcare? And the answer is yes. It's not ideal that children are in multiple stable groups during the day, but it would be pretty impossible for a childcare provider to mimic the school stable group. So it is going to be allowed, although certainly not ideal, and you want to reduce it if you can, but probably there's not much you can do with that. Okay, questions about PPE, personal protective equipment. Is there any money available to help with PPE? And so what I can tell you is that one thing is we're working on additional grants for childcare programs who receive grants in round 1 and 2. And I think some information actually is going to be coming out very shortly on that. So keep an eye out. There will be announcements made. But we're also working on securing a vendor where you could access PPE directly at a discounted price. So it's in process. We're working on it. We know that it's a definite need that providers have. So what do I do if a child refuses to wear a face covering? You know, we've talked about in the guidance that children can't be disciplined for not wearing a face covering, and we're just asking that you do the best you can to work with parents, help the child to feel comfortable. We're posting a resource online from the Oregon Health Authority about tips on using masks with children, ways to make it fun, have children decorate a mask, have them look in mirrors and make faces at each other, and talk to them about how the face covering is to support the health of our friends that we have around us. But we don't discipline children for not wearing one. So then what if a parent is refusing to wear a face covering at drop off or pickup? So, you know, part of the requirements of the guidelines is that you're really working with your families and informing them of the requirements, of all the requirements really, and especially about drop off and pickup. You need to communicate directly with your parents, address barriers that they may have. But ultimately, if they're unwilling to wear a face covering and support your ability to comply with the rules, emergency childcare might not be the best option for them. If you've done all that you can do and the parent is still unwilling to wear a face covering, then they're just not permitted to do the drop off and pickup, and they'll have to make alternate arrangements. So question about outer layers and if they're required to have long sleeves. So if you look in the guidelines, there are 2 different sections that give examples about what can be used for an outer layer. One of the contexts is for the health check and for the floaters. And in the health checks and the floaters, it doesn't specify long sleeves, and actually even gives an example of aprons being allowed to be worn. So for health checks and floaters, aprons are allowed, which would not have a long sleeve. It's for the infant feeding where long sleeves are required. So the idea is that when you're feeding an infant, that you've got something that's completely covering your front, including your arms. And that can be a blanket, it can be a sheet, it can be a smock, it can be a long sleeve shirt, but it does need to be something that fully covers the front of you. And if that covering is soiled, then you need to get a clean one. You can use the same covering for an infant multiple times in a day if you're feeding the same infant. So in that way, when you think about how your infant room is running, think about primary caregiving and maybe assigning infants to different staff, which we know is better for infants anyway if they're bonding with the same people. So for infant feeding, long sleeves is where the requirement is. Okay, let's see, where are we? Daily activities. So there's information in the daily activities section that talks about keeping children separate, having separate activities, and it doesn't say to keep children separate. It talks about trying to plan activities that would provide space for children. So the question is, are we asking providers to not allow children to play with each other? And no, that is not what we're saying. What we're asking is that you work on the limit of sharing of materials as much as possible. This can be done by dividing materials up among children. Everybody has their own little bin of blocks or of Legos, and then cleaning materials after they've been used. And if children do share materials, have them wash hands or use hand sanitizer afterwards. But we recognize in childcare and with young children that they're going to touch, they're going to interact. And so we're just doing the best we can. We do have a resource on our website that's physical distancing activity ideas for childcare providers. So that might be something that you want to look at in the provider tab under resources. I think it has some great ideas there about how you can kind of accomplish this and support children. Okay, next one, cleaning and building maintenance. So question has come up about what does it mean to clean sinks and faucets after each use? Does this mean after a stable group or after each child within the stable group? And we know that to properly sanitize and disinfect, you have to let air drying happen. So it would really be impossible to do that after each and every child washes their hands. So after each use is referring to after a stable group uses the sink, not after each individual child. Okay, so responding to possible COVID cases, this is kind of new in the guidance. So the question is, can a child or staff return if with COVID-19 symptoms if they have a doctor's note? So a child maybe has a fever due to an ear infection or an infant due to teething. The person can return with a doctor's note if they are fever-free for 24 hours without using the medicine. So they have a doctor's note, no fever for 24 hours without using fever reducing medicine, and the doctor says that they're cleared, they can return. So can a child or staff return to care with COVID-19 symptoms and a negative test? Yes, they can return 24 hours after resolution of cough and fever without using the medicine. So in the first example, it was about the fever-free being gone. Second example, when they actually have COVID symptoms that involve a cough, both the cough and fever need to be resolved for 24 hours, and then they can return with a negative test. Okay, I think that is it for the major ones that I've been seeing themes for. So now we're going to open it up to you, and I'm going to invite my colleagues Ellie and Catherine to join me in the answering as we get the questions.
Great. So there's a question about physical distancing and comforting children. Is it okay to hug a child when they're sad or otherwise engage in care that involves touching the child?
100%. You know, when childcare, you cannot properly care for children and physically distance yourself. And I think the guidelines really address that. If you read the introduction to the guidelines, which I know it seems like it's 11 pages, but honestly, I read it and it had such valuable information, and it addressed that topic, that part of being an early childhood caregiver and what children need is that close comfort and touch. Physical distancing within a stable group is not required. What we're asking is that teachers from outside that stable group are staying physically distanced from children that are not in their stable group and from other staff members. But yes, please hug and hold the children and give them what they need.
So does that mean when children line up to go home, if they're part of the same stable group, they don't have to stand 6 feet apart?
There is no requirements in the guidelines that children are standing 6 feet apart. What we're encouraging is that you set up activities that promote space, but there is no requirement that they're always maintaining 6 feet distance. You just, you know, you do the best you can. We know 3 and 4 year olds are going to come within contact of each other, and even 7 and 8 year olds.
If a child is kindergarten age but not enrolled in our kindergarten, do they need to wear a mask?
You know, thank you for asking this question. I'll say that we internally have some debate going on with that, and I'm expecting that we're going to have an answer finalized very early next week, and we're going to get that posted online. You know, the debate has been enrolled in kindergarten versus age eligible for kindergarten, and so I plan on nailing down that question very early next week and getting that posted on our FAQ.
Children use a face shield instead of a face mask?
Absolutely. Face shields are allowed for children and for staff. And I know that there's been a lot of concern about being able to see facial expression, especially for children learning to speak. Face shields are a fine alternative. They do need to be disinfected when they're dirty and at least daily. And I know that, you know, for face shields, there is some concern because they don't close up the sides. So there is concern about spray that can happen there. But we recognize that for some children, some adults, and some environments, that that's really a better option. So it is available.
Great. Will there be a blank cleaning checklist?
Oh, you know what? That's actually a great idea. I think we can look at making something like that. It would be really based on, I think, the table 5 in the document, but we'll take that down and take it to the group that's working on those documents.
Okay. We've been closed. At what point can we reopen without applying for emergency care?
You know, right now, that's just not even on the table. Applying for emergency care is required in order to operate right now. So I don't have an answer. You know, we're watching the science on COVID as it's continually evolving, as well as watching the cases in Oregon. I would say it's pretty safe to say that the long.
Are stable groups at school required to be 10 and under, even if you have a capacity of 20?
Are groups at school required to be 10 and under if you have a capacity of 20? I'm not completely sure if I understand the question. You are allowed groups of 20 now. That guidance changed as long as you're not in a baseline county. As of September 1st, you need to have all the guidelines implemented, and that includes that you can be in a group of 20.
So speaking of gyms, are kids allowed to use facilities like gyms that are not able to be washed and scrubbed in the same way as smaller space?
Catherine, would you like to take that question maybe?
Sure. So right now we allow gym spaces to be used. More people have tended to ask about it as a classroom, but you couldn't have more than 2 groups. But you absolutely, if you've got access, to a gym, you're just going to want to have, one group at a time using it to keep it away, from the other. If it's a really large space and you can divide it into 2, you can do that. Again, keeping the kids distanced from each other, the groups not mixing.
And let me just clarify something that Catherine said. If you are using a gym as your classroom, you're limited to 1 group of 20 children. You can't have 2 groups in it. You can have 1 group of 20.
Will substitute teachers and floating staff be allowed to fill in when staff are out?
Yes, they would just have to follow the floating guidelines of having an outer layer of clothing that is used for each of those groups. And if I recall now, the masks, you can use the same face covering with different groups, but you would be required to change your outer layer. And as much as possible, you want to limit the number of staff interacting with a group. So try to use the same people to cover the same group as much as you can.
So when we talked about long sleeves during infant feeding, I had a follow-up question. Does it have to be changed between each child or only if it's soiled?
So you need to have a long sleeve covering for each child, but that one can be used multiple times for that child. So you have 4 children maybe that you're responsible for in your group. So you're going to have 4 different outer coverings minimally. And then if one of them gets soiled, then that one needs changed for that infant. So that infant might have more than one used in a day.
Thank you. Are pre-K kiddos needing to wear a mask?
Catherine, you want to take that?
Yep. No, we don't require masks of children ages 2 to 5. So no. Now, again, if a parent asks you to, you certainly can. But again, there's requirements. They have to be able to remove it themselves. They can't wear it during nap time. I can't remember, Tammy, was there another one?
Well, if they have a medical exception.
Or if they had a medical, yeah.
Yeah, you just need to make sure that they're able to control that face covering themselves. And we also are working on a kind of a sign-off permission form that you would be able to use with parents that outlines guidelines for that and the agreement that you would have with parents. So we'll have that posted also.
Okay, there's a struggle with supporting agencies like state fire marshal and sanitation inspectors with getting inspections done in time for licensing renewals due to COVID. If we are open and running classes, will we be held harmless or be out of compliance?
Yeah, so what we really strongly, and this goes in COVID times and non-COVID times, if you get your renewal in timely, then you can operate on your previous license for until we can get through the process. So please just make sure that you've sent your renewal application in at least so that we'll receive it at least 30 days ahead of time. And then you are good to go. And, hopefully the fire marshal and sanitarian or environmental health specialists will get out there. But you're good to go until you're able to schedule those.
And I would just add to that, if you're having trouble getting them out, contact your licensing specialist and they can help. They know who's working in the areas. They could maybe reach out for you if need be. So look to your licensing specialist for help if that's an issue.
For a region that has lower temperatures already and possibly for everybody in the future, how is it accurate to take somebody's temperature outside if it's 38 degrees?
That's a question that we're going to have to take to the Oregon Health Authority. I don't know how outside temperatures affect your internal temperature or whether it does. So we'll take that forward to the Oregon Health Authority for some guidance.
Okay. Do cribs need to be 3 feet apart like cots and mats?
Oh, you know what? When I think about what the guidance says, if I can recall, and Ellie and Catherine, if you can jump in too, I believe it talks about cribs or cots, mats, and beds, but it doesn't specify cribs. I'm going to have to take that one forward too, because my guess is the intention was for cribs, but I don't know that it called it out. So we'll take that one forward.
Thank you. Did we check in with healthcare professionals before our guidance was written? There are things that don't match other things I've heard.
Yeah, I mean, I would need more specifics about that part, but what I can tell you is that we did engagement sessions with multiple groups of childcare providers, and I personally was involved in those engagement sessions where we received feedback. We also had a survey that was posted for everybody to provide input. We received over 1,600 responses to the survey from childcare providers and parents. And even if you look in the guidance document in the beginning, it does outline the outreach and the measures that were done. So we absolutely heard from providers. And I would even encourage you in the guidance document, when you go through the first part of the introduction, it goes through every single section, the 14 sections, and talks about the guidance, the information that we heard, the feedback we received, and how the decision-making process happened with where the guidelines ended up. So take some time to read those intro pages. I found them to be really enlightening.
Okay. I think the question was indicating that the healthcare advice, like healthcare professionals aren't having to change their outer layer in between patients. So why are childcare providers changing outer layers?
Got it. Okay, sorry if I misunderstood it. All of our guidance was made in close conjunction with the Oregon Health Authority, which also contains physicians. And I think when I think about what is the difference between, and I don't know this is just Tammy Scott thinking about it, with a healthcare provider, they're adults who have the ability to control the distance that they're having with contact with individuals. When you're a child care provider, like we talked about earlier, you're caring for children, and children need to touch and be near and be held. And so there's just a different level of contact that I think happens with the child care provider. But again, that would be a question for Oregon Health Authority. I couldn't really speak to that very adequately.
Okay. What are the approved CPR first aid online classes?
Oh, off the top of my head, what I can tell you is that we have a document posted right now on our website in the provider section for resources. So off the top of my head, I don't have them memorized, but I can tell you also that we are updating it to kind of focus in on online CPR courses that we have found seem to be a little better vetted, shall I say. But there is a resource on our website on the provider tab with online options already.
I didn't think that materials needed to be sanitized or cleaned after each use, just if they came into body fluid contact and at the end of each day. Do we now need to clean materials in between each child?
Yeah, very good question, because I know in the daily activities section, it talks about cleaning them after use. And then in the table 5, in the cleaning and disinfecting section, it talks about daily and at the end of the day. So that is a question that I'm working on for our FAQ and that we'll have posted online. So look there for a definitive answer, but I hear what you're saying.
Okay. Why are we not able to wash kiddos' hands, let them play in a sandbox, and then wash their hands again? Same question with sensory tables and water tables.
Yeah. And Ellie, I think that you might have some insight into this. You talked about it the other day. Would you care to take this?
Absolutely. So for sandboxes in particular, they are sort of a breeding ground for bacteria. And as we know, children can't help whether or not they touch their face or really anything else. I know that kiddos adjust their masks even when we ask them not to. And so sandboxes, that's really a tough one because we reached out and asked for some specific guidance around that. Hopefully that helps.
Yeah, and I would say that this is guidance that we received from Oregon Health Authority. And I think where Ellie's talking about that you just can't control the bacteria spread as well with those environments.
Yeah. What happens when a child or staff has a fever at health check? Are they to be excluded for 14 days?
Yeah, so if a child has a fever, you're doing a health check and you see an elevated temperature, they're not permitted to enter into care. And then the exclusion period for a fever is actually 10 days. And I know it's easy to get those two concepts confused. The 14 days is if you're actually in quarantine because you've been exposed to somebody who has a confirmed case or a presumptive case. So when you've actually been exposed to a person that you know has COVID, then it's a 14-day quarantine period. The child that shows up with a fever, that's a 10-day exclusion. And then we talked about earlier a couple of the things that could mitigate that and provide them the ability to come back into care, which would be a negative COVID test, with having the fever and the cough, if they have a cough, resolved, or if a doctor's note indicates that they're safe to return and they have 24 hours fever-free without fever-reducing medicines, then they would be able to come back. But the initial response is out for 10 days unless they have one of those two factors that brings them back into care.
And I can take this next one, Tammy. The question is, can children under 5 be asked to wear masks and or face shields while inside? And ELD supports your right as a business owner to make that decision about whether or not you want to ask for additional things. What we did is we provided the minimum. If you want to clean more, clean more. If you want more people to wear face masks or face shields, that's absolutely your right to do that. We do tell you, though, that not all children under 5 should. Children 0 to 2 really shouldn't wear a mask because they can't put it on and remove it on their own. And no children should be wearing it when sleeping.
Right. And absolutely no children under the age of 2, even if they're able to control it themselves with it, they can't wear them. Right. Thank you, Ellie.
Can linens for rest time still be brought from home, or does the school need to provide all linens?
They can be brought from home, and so they need to be washed weekly, and so you can bag them up at the end of the week and send them home, or if they get soiled during the week, they should be laundered more often, but they can be parent provided, just as long as you are very clear with parents that they need to be washed in nice hot water before they're brought back.
Okay. So just to further clarify the question earlier about gyms and then the difference between the allowance of 10 versus 20, there's a clarifying question about, can gyms have 2 groups or is it 1 group of 20?
So it's really quite clear in the document that gyms are limited to 1 group of children of 20, regardless of how large the gym is. And I think, the thought process is, if you were putting 2 groups of children in there with 40 children, gyms are pretty hard to divide up. That's a lot of children and a lot of airspace that's being shared. So it is limited to just 1.
Okay. Does this mean if our county goes back to baseline, does the group size go back to 10?
It does. If your county does go back to the baseline phase, then group size does have to go back to the current standards of 10. And what baseline phase means is that you're basically on a stay-at-home order because the virus is not controlled in your county. So you do have to drop back to 10. But as we talked about, I think the very first question that we did, we recognize that there's going to have to be some sort of a phasing, that you can't one day have 10 and then the next Monday your county is back to baseline and you have to reduce half your children. So we're working on what that phasing would look like. But the idea of baseline is that the county does not have a good control over the virus and everybody is, basically told stay at home.
Can we have parent volunteers if we treat them as floaters?
If you have stable staff with your group, so you cannot have new parent volunteers in every day, that's not a stable staff. If you have the same volunteer every day and it's a stable group, then you could, but you cannot just every day have a new parent volunteer, and that's not going along with the intention of stable staff with stable children. There's just too much risk of spread of the disease.
Are masks required for in-home programs?
Catherine, would you like to take that one?
Sure. So yes, they are. However, if they've got family members who are in the home and they're in areas that are not the child care areas, then they wouldn't have to wear the mask. But if they come into the child care area or the kitchen that's used by the child care area, then they would be having to wear those masks.
If floating staff are in multiple classrooms per day, can they have a mask and an outer layer of clothing for each classroom, such as hanging up a mask and a smock outside of whichever space they use?
They absolutely can. And I feel like even the requirement now is that not that the mask gets changed in the new location. It's just the outer layer that has to get changed. So have it hung up. When they enter into that room, they put on that outer layer and they're good to go.
Yep.
Is the outer layer only for health checks at the beginning of the day, or do you have to have an outer covering all day?
So the outer layer is specific for the health check and for floaters and for infant feeding. So the just the normal teacher or assistant who's in a classroom who's not floating or doing the health check, they do not have to. Ellie, we received a question on Facebook that was about our Toys from Home Allowed. And I know we got this question on Wednesday when I did this Q&A with family childcare providers. And I feel like I want to write it down and capture it for our FAQ because I'm not confident of the answer. I know I gave an answer the other day. And I'm just, a little not confident about it because the more things that you enter into the facility, the more chance of bringing the virus in. So I think I'd like to take that one and work on it for our FAQ that we'll post.
Got it.
Okay, during health checks, we use no-touch thermometers. What are the requirements for sanitizing between each child if they never touch? I know we were allowed to use gloves prior to August 14th. This would be for bus transportation as well as self-transport health checks.
I don't know enough about the different thermometers. Catherine and Ellie, do you guys have any thoughts on it?
I was going to say, my understanding is that they don't need to sanitize the thermometer between children if it doesn't touch the child.
Okay.
And that would make sense to me as well. If it's never touching the child, that you wouldn't need to.
Okay.
Most of the information that we have about this virus is really about a specific period of time of exposure and the length of time it takes to check a child's temperature with the no-touch devices is not within sort of the realm of what we've been educated about for this virus. So there's a concern that the answer about parents' PPE at drop-off and pickup seems to sort of imply that we should ask families claiming medical exemptions to not have the parent with the exemption conduct pickup and drop-off. So should we still provide distanced accommodation for parents that claim a medical exemption from covering their face?
I think that we got this on Wednesday also, and I feel like we need to do some checking with OHA on this one because I'm not real sure on what to do with parents with a medical exemption. So we're going to follow up with OHA.
If you filed for emergency childcare, when will you be told if you've been approved?
Most of the time it's a very quick turnaround. Occasionally there's situations where there's other things happening with the license that require a further review. So if you're not hearing back, I would encourage you to first try to reach out to your licensor. And if that's not working, then you can always reach out to the regional manager for that office and find out kind of what the status is.
Yeah, but I would add, typically the turnaround time on those is really just a couple days, maybe.
From the time that it's assigned. So if
Right,
you've submitted your application and it needs to be processed by our intake department, some of those applications include an emergency background check, which is a little different. But from the moment that it reaches the licensor, it's only a few days.
That's a really good point, Ellie. And, same as for childcare facilities, we know fall is a very, very busy time for childcare programs as they're gearing up for this new school year. And many childcare programs have gotten licensed in the course of their history at fall time, which also means that fall time is the busiest time for Office of Childcare, both central office and the field. Our workload typically more than doubles during August, September, and October. So that can also cause a little bit more of a delay by a few days within our central office processing. Not by weeks, not by months, but by a few days. So, you know, you can figure, you know, a week that your application is with central office and then assigned out to the licensor a couple days if there's no additional review that needs to occur.
Okay. Are the mask requirements for teachers and students different for small in-home programs than they are for centers? What if all parents in the group agree they are okay with their student teacher to not wear a mask? And as far as we have the guidance, it's on an individual basis. Each of those things require a doctor's note and specific to an individual, not a group agreement. And so the guidelines are required. If that doesn't work for parents, as Tammy indicated before, maybe emergency childcare is the best solution for them, and other types of care might best meet their needs. But outside of medical necessity, we don't have any sort of group exemption.
Right, and we have received a lot of feedback about the face coverings, and you know, a lot of thought and work went into this with the Oregon Health Authority, and really what we know is that face coverings are one of the most effective ways to control the spread of the disease, and so that was really where that decision came in. You know, we took into consideration all the input that we received, and it just was outweighed by the growing evidence that face coverings are so critical to prevent the exposure, and so that's where it landed. And I know we received a lot of input on that, but there aren't exceptions except for medical.
We have a question about playgrounds. We have a playground at our school that the public also accesses sometimes. Can we use it? And if we can, do we have to clean it prior?
Yeah, I would say, you know, what the guidance talks about now is that playgrounds have to be sanitized between stable groups. So if you have the public using it, I would say you need to go out there and do a cleaning on it before children get on it.
We have 4 teachers' aides that all work different days. Is this considered our stable group?
Catherine, do you want to take that one?
Ooh, you know, tough. I think the best practice would be trying to be as consistent as you can with which teacher aides are assigned to which group, and limit as much as you can, the sharing of that. Granted, that is not going to always work. So, but again, then you're really going to have to almost look at them like floaters. And like I said, the important piece is we're just trying to create as much, stability in staff and children as possible. So I would certainly suggest looking at your schedule to see if there's a way that you can create a more stable group.
Okay. If sanitizing is required upon entrance, are infants exempt from this? And if a parent does not want them to have sanitizer, are they also exempt?
Yeah, and we don't recommend putting hand sanitizer on infants. And I think that this is a question that we need to take back to Oregon Health Authority. My best advice right now is when an infant arrives, carry them in, take them to your hand washing sink and wash their little hands in the sink. Hand sanitizer does not go on infants.
Okay. I just want to acknowledge that there was a question again about requiring masks versus shields, but both are acceptable. We say face coverings. So I just have seen a couple more of those, and I don't know if if they came in before or after that was answered. So for the sleeping requirement that's 36 inches apart, is it still true if there's a barrier in between each sleeping arrangement that might be less than 3 feet, but is, like, for example, a shelf?
Yeah, that is actually one of the things that I'm putting on the FAQ that I hope to get posted soon. And I would say if that barrier is solid, meaning there are some bookshelves that have open holes that go right through, so that would not count as a barrier. But if there's something solid and you can maintain adequate supervision over both of the children, I think that would mitigate the 3 feet. Catherine, do you have any other thoughts?
No, I would agree with that. Again, I think the critical piece with that would be supervision, and then making sure the teacher or person, you know, is in a spot where you can see everything that's going on still.
Yeah. So just double, triple checking. It is okay to have a group time where children are sitting closer than together.
Yes.
Double, triple answering yes. Children, I mean, if you can do it, I would say what's better, and some of the examples that we've given in our document that we have posted, is that every child has a hula hoop that they sit in or something like that that creates their space and would also be fun for them. And so, you know, you want to do those things when you can as much as possible.
Yeah. So to get to the staff bathroom, staff have to walk through a classroom that's not their own. How do we manage that?
Ellie, Catherine, any thoughts?
Well, my thought would be it's similar to when we were allowing kind of divided spaces. So you're going to walk along the edge of the room, you know, and go around the group. You may kind of create sort of a path. You know, sometimes people have been using things like duct tape, you know, to kind of create a visual so the kids aren't going into that space, and then, you know, people that need to walk around could use that space to get to where they need to.
And I will also add, in the guidance, there was a definition added about what exposure means. And we are also putting in on the FAQ, kind of for your purposes and contact tracing, what does exposure mean? And exposure is in the context of that would be within 6 feet of another individual, or we're saying if they're in a classroom for longer than 15 minutes. So I think walking along the edge, touching nothing, not interacting with the children that are in the room, and just making it a brief walkthrough, I think is okay.
Yeah. Do recorded programs also need to apply for ECC at this time?
They do. Recorded programs are required to apply for ECC. They are required to follow all of the guidelines that were put out on August 14th, as well as have their staff background check through our emergency background check. The difference that is going to be happening is that we're not going to be doing an inspection like we were, but they still have to follow all of the requirements.
If we have a positive case in just one class, does the entire center have to close, or would it just be that stable group?
Yeah, so that's something that you're going to work with your local county health authority about. Typically, it's just that one group. And that's why it's important to keep your floaters to a minimum, because if you have a floater in that room, every room that floater then went to is going to end up affected. So keeping those staff in smaller groups and not floating to a lot of rooms is going to really be beneficial for you if you do have a case occur. And so typically it's just going to be that group, but local public health is going to help you walk through that and identify everybody who would need to go into quarantine.
Do we know how long emergency pop-ups will be allowed to operate? There were a handful of questions about this, so I'll summarize what I read, but it includes questions like, are we going to be given enough time to pivot our space and seek other ways to operate?
Yeah, I mean, very good question. I'm expecting that next week at some point, maybe late in the week, maybe early the following week, I'm not positive, a revised temporary order is going to come out that's going to address that question. We know that with fall coming, there are many school-age children that need a place to go. So we are anticipating that there's going to be a rise in the emergency childcare that we're kind of seeing as an expressway to licensing. So I think we're going to see guidance coming out about just how long you can be on that expressway to licensing before licensing is actually required. I did a meeting yesterday with some school age folks, and the discussion really was the emergency pop-ups were made for a very specific time back in March and April when we didn't really know how long this was going to be going. And now, because we're 5 months later and things are going on much longer than planned, emergency pop-ups were not meant to be a long-term solution. Licensing really is the foundation for children's health and safety. This is recognized at the state level, but really nationally. Every state has a licensing system to help protect children's health and safety and make great places for them. And so I think we're going to see a transition to start bringing those those emergency childcares that aren't licensed into the fold so that they are required to follow the same rules. And so keep an eye out for the temporary order. I think it's going to address it.
Catherine, do we have to take the temperature of adults who are dropping off or just the kids?
So just the kids, and then staff actually can self-attest. You don't have to do it for their own staff.
Okay. So there's a question around when a child turns 5, do they need to wear a mask, or is it when the child is kindergarten age and eligible, or kindergarten age and enrolled?
Mm-hmm.
Right. So like I mentioned earlier, we are still having discussion about that. The people that I needed to finalize that discussion were not available this week. And so I expect that very early next week, we're going to nail down that exactly between those two scenarios, and we'll post it on our FAQ online. So keep an eye out on our website.
Catherine, can a provider remove their mask to eat or drink since there are no other staff to allow them to leave the childcare area when they need one?
They can, because you have to eat or drink and you can't do it through your mask is what I would say. So yes, you're gonna set it aside, or put it in a place, where it's not gonna get food spilled on it or things, because if it gets soiled, obviously you'll need to change it. But yes, you can take it off to eat and drink.
And I do believe the guidance also requires hand washing after you've handled the mask.
Good. Yeah.
Okay. If there are 2 classrooms that are connected by a bathroom, can both groups use that bathroom? There are doors that close to the bathroom on both sides.
Yeah, I mean, both groups can use it, but you need to clean and sanitize the space in between group usage. So you're going to need to really develop a bathroom schedule, recognizing that preschoolers don't necessarily use the potty on a schedule, but you're going to want to, maybe every hour during a 15-minute period, it's one room's use and then the other room's use, and then clean in between.
Okay. Are there contact lists for who we should talk to in our region? I don't have additional information. I'm wondering if maybe that came from a recorded program or a pop-up. But I would say call customer service and let them know what you need, and hopefully they can route you. Sometimes if they don't know who to route you to, they'll route you to a regional manager who will do some sort of investigating to help you get connected with who you need to. I wanted to acknowledge that question, even though I don't know if I have enough information to answer it the best.
And let me just add on to that, our customer service phone number, which is a good starting place if you don't know who to call, is 1-800-556-6616.
So there's questions about ODE and ELD requiring a blueprint. And so I just wanted to acknowledge, I know there are 77 open questions, and I can see there's some frustration for people who haven't seen their question answered yet. The more times you ask it, the harder it is for us to get through them because we're trying to screen them. So I have somebody who said, I'm asking for a 3rd time, so I'm going to just address it. There's no blueprint required for ELD. If your program requires a blueprint because you're operating under something that ODE oversees, that blueprint would go to them, not to us.
Correct. I do want to, we have a question on from Facebook, and it was about, are there guidelines for school age day camps? And there really isn't such a concept as school age day camps. If a program is caring for school age children and the children are dropped off and required to be there until someone comes and picks them up, then that requires licensing. And so what you would need to do is first start out with getting emergency childcare approved as doing childcare, and then you need to start working towards licensing. And part of the being approved for emergency childcare is showing community need. But I think right now, with the fact that children are not in school, we know that there's a lot of community needs. So I don't see that as being a hurdle to getting approved for emergency childcare, to be actually doing childcare as opposed to a recorded program.
I do just want to do a quick reminder too that your licensing specialist, while they are receiving a huge influx of these questions, is also a really valuable resource. So if we don't get to your question in the next 6 minutes, please reach out to your licensing specialist. If you are a recorded program, or a pop-up, please contact our customer service. I don't want people to feel like if we end this meeting that they can't get their questions answered. This isn't the only avenue. So I'm going to move on to the next one. So for outer laying, does it not include pants? Are pants not considered part of the outer layer?
Yeah, the outer layer is meant to cover your upper body.
Mhm.
If only one stable group is attending a facility, does the gym equipment have to be cleaned daily?
You know, the guidance talks about the outdoor play equipment being sanitized between use. I think it's reasonable to think that you would want to apply that to the gym equipment also, because the goal, of course, is to eliminate the spread of the disease. And the more cleaning that you do, the better chances you are that you're going to catch it.
For documenting drop-off and pickup, can people write mom or dad and have a master list of parents' names attached instead of writing the full parent name, or do we need the full parent name?
Catherine, I think that's reasonable. Would you agree if they know who mom and dad are?
Yeah, I would say as long as you know it's mom to Tommy and you know who that is, yeah, I think that would be fine.
Do staff need to change masks when going into different stable groups? We only talked about outer layer.
Right, and so the guidance does not require that anymore for face coverings, that it's the outer layer that gets changed. For floaters, the face covering can remain.
Mhm.
When children share toys and then go wash their hands, the toys need to be put away to be sanitized, or can others play with them?
So what the guidance talks about is that cleaning after they're being used, and that's one of the areas that we talked about earlier that I need to get some clarification on, because one section of the guidance document talks about cleaning it after it's being used. Another section talks about a daily cleaning, so I do need to get some clarification, and we'll put that into the FAQ. And it looks like we are down to 4 minutes, Ellie, so pick your top ones that are getting lots of hits.
Yeah, so can a child attend Head Start and your program, or can they attend your program and school?
They can, and this is very similar. We answered this at the very beginning when we talked about when children start going back to school, that although it's not ideal that children are in multiple stable groups a day because they are attending multiple programs, it is something that would be allowed.
Okay.
I have a question from Facebook about, can parents do a health check from home? And the answer to that would be no. The temperature needs to be verified by the designated staff, and the questions, well, there's 4 questions that you have to ask, and that needs to be done with the person who's dropping off the child.
Sorry, I'm seeing quite a few repeats because people are, I think, nervous about not getting their questions answered.
So one thing I encourage, like next week, we are doing small group meetings where they're going to be able to meet in small groups and break up. And so might be, able to get their answers that way too.
Yeah. So I have a couple more, and I think I can answer a handful of them too, since I've had time to prepare because I can see them in writing. Can we use a blanket from each infant to wrap around ourselves as we feed that specific infant? Yes, that's a really great way to follow the rules. As long as that infant is specific to that child, and you use a different one for the next infant feeding, I think that's a great solution. Does it matter which COVID test the person gets? There are rapid tests and a second test that takes longer. No, we're not regulating what type. If they get an answer, then you're going to follow whatever the guidance tells you, dependent on the results of that test. Now, if they get a rapid test and then they also get a second test that takes longer and their rapid test says no, there are still exclusions because of their symptoms and they need to be symptom-free. And my guess is by the time they become symptom-free, they would have the results of that second test to be able to make a longer term decision. Can new hires complete CPR and first aid online?
Yes.
Okay. If we have a divider that goes from floor to ceiling in our gym to divide it, can we have 2 groups?
So, the guidance is very clear with gyms that 2 groups are not allowed, and we aren't able to make exceptions to that. Okay, it's 10:59. Ellie, I have a couple more slides. Do you have any quick hit questions?
I just the question about 20 kids can be in a classroom as well, not just gyms. And the answer is yes.
Yeah, provided you have the appropriate square footage, they're preschoolers or older because they can have a group size of 20.
And that your county is in the phase that allows it.
Yes.
And one last quick question from Facebook is about, should kids bring lunch in a bag versus a lunchbox? And I don't believe that we've received any guidance about that. I think a bag would be something that you could throw away and maybe would prevent the spread of germs more, but we haven't received guidance, so I would say either one is an option. Okay, we are gonna wrap it up with a couple more slides. Thank you all. First off, we just want to say thank you. We know how hard this is. We know that childcare has been doing a really darn good job with keeping children safe. There's been, I mean, the last official report that we put in the guidance was that there were around 60 confirmed cases in childcare. I would say that every day I'm hearing of 1 to 2 more, so the number is higher now, but still, when you think about the number of children that have been cared for and the number of programs, you guys are doing an amazing job, and thank you for taking it so seriously and trying to prevent that spread. A couple resources that I wanted to share is that there's a map that you can click on that will show the status that your county is in and whether you're being watched. So here's a link for that, and I'll show you what that looks like in just a second. Also, if you have additional questions, as Ellie mentioned, your licensor is going to be a great resource. They're going to be able to help you through with the questions that we weren't able to get to today. We have a Q&A session next week. We also have an email that you are welcome to send those questions to. We also want to hear your ideas. If you can think of things that would be helpful, supportive documents, let us know and we'll see what we can do. So here's an email for you to resource. And then the link for the county status map will take you to something that looks like this. So you can see I printed this off, I would say 2 or 3 days ago. There are no counties right now in baseline. If there were any in baseline, there would be something in the key here showing a baseline color. So that's really great news. And you can see which counties are in phase 2. The striped one with the darker means that that county is on a watch list and they're in phase 2. The striped lighter color means that they're in phase 1 and on a watch list for going back to baseline. And then the ones that are solid color are pretty solid right now, but that can fluctuate. What you need to be aware of is if you go into baseline phase, and hopefully that won't happen. Hopefully all these counties are getting a great handle on the virus. But like we mentioned before, there would be a phasing period. So we're working on that policy right now. So I thank you so much for joining us today. Thank you for your great questions and thank you for all you're doing. I hope you have a wonderful day.
Thank you.